The approach for jumping a hurdle starting with the neck, shoulders, and back. The deltoid that flexes and laterally rotates the shoulder arm during stride. The trapezius elevates arm and allows the arm to swing through, and the latissimus dorsi allowing arm extension and medially rotates arm. The OIA chosen was the trapezius, the origin medially of 1/3 of the superior nucleoline spinous process of vertebrae, the insertion laterally 1/3 of the clavicle, medial side of the acromion and upper crest of the scapular spine, and the action elevates and depresses scapula, rotates scapula superiorly, and the joint chosen is the glenohumeral joint. It's a ball and socket joint with the head of the humeral in the glenoid cavity of the scapula, allows arm movement. And
for the movers of the arm, we chose the biceps brachii, which flex the arm for elevation, triceps brachii, which extends the arm, and pectoralis major, which flexes and adducts the arm and medially rotates the arm. For the OIA, we chose triceps brachii, and the origin is the infraglenoid tubercle of the scapula. The insertion is the olecranon process of the ulna, and the action extends the forearm. And the joint that we chose is the radioulnar joint, which is a hinge joint in the elbow.
The movers of the hand include the abductor digiti minimi, abducts fifth digit. The flexor digiti minimi brevis flexes the metacarpal phalange joints of the fifth digit, and the extensor pallius longus extends the thumb at interphalangeal joint. And the OIA chosen is the abductor digiti minimi, and the origin is the pisiform, the insertion base of the proximal phalanx, and the action abducts the fifth digit.
For the legs, glutes, and abs, we have the oblique, which flexes and laterally bends the trunk, and the biceps femoris, which extend the thigh and flex the leg, and the gluteus maximus, which extend the thigh laterally, rotates the femur. For the OIA, we chose the gluteus maximus, and the origin is the posterior gluteal line, the posterior surface of the sacrum, and the coccyx sacrotuberous ligament. The insertion is the upper fibers of the iliotubular tract, the lowermost fibers of the gluteal tuberosity of the femur, and the action extends the thigh and laterally rotates the femur. The patella, also known as the kneecap, is a thick, circular, triangular bone which articulates with the femur and covers and protects the anterior articular surface of the knee joint. Anterior articular femur.
The airborne results, starting with the neck, shoulders, and back, we have the trapezius, elevates arm, allowing arm to swing forward. The levator scapulae elevates scapula, and the subscapularis assists extension of the arm. The OIA chosen is the levator scapulae. The origin is the transverse process of the CI to C4 vertebrae. The insertion medially bordered the scapula from the superior angle to the spine, and the action elevates the scapula. The joint chosen was the hinge, which is a synovial hinge joint between humerus in the upper arm and radius and ulna in the forearm.
For the leg, glute, and abs, we have the coccygeus, which elevates the pelvic floor, the abductor hallucis, which abducts the great toe toward the midline of the foot, and the gemella superior, which laterally rotates the femur. For the OIA, we picked the coccygeus, and the origin is the ischial spine. The insertion is the side of the coccyx and the lower sacrum, and the action elevates the pelvic floor.
The movers of the arm include the brachialis that flexes the forearm, the pectoralis major that medially rotates arm, and the infraspinatus laterally rotates. The OIA chosen is the pectoralis major. The origin is medial 1/2 of the clavicle. The insertion is the crest of the greater tubercle of the humerus, and the action flexes and adducts the arm, medially rotates the arm.
For the movers of the hand, we have extensor carpi radialis longus, which extends wrist and adducts the hand, flexor digitorum profundus, which flexes hand joints, and the extensor carpi radialis brevis, which extends wrist and abducts the hand as well. For the OIA, we chose extensor carpi radialis longus, and the origin is the lower 1/3 of the lateral supracondylar ridge of the humerus. The insertion is the dorsum of the second metacarpal bone, and the action is extends wrist and abducts hand.
And the following sprints include, starting with the neck, shoulders, and back, the interspinalis that extends the trunk and neck, the spinalis extends and laterally bends head and neck, and the pectoralis minor draws the scapula forward, medialward, and downward. The OIA chosen is the interspinalis The origin is the upper border of the spinaeus process. The insertion is the lower border of the spinaeus process, and the action extends the trunk and neck.
For the movers of the arm, we have brachioradialis, which allows the arm to supinate in order to run, the coracobrachialis, which flexes and adducts the arm, and pronator teres, which pronates the forearm. The OIA we chose is brachioradialis, which is the origin is the upper 2/3 of the lateral supracondylar ridge of the humerus. The insertion is the lateral side of the base of the styloid process of the radius, and the action flexes the elbow and assists in pronation and supination.
The movers of the hand include the extensor carpi ulnaris that adducts the hand, the extensor digitorum that extends finger joints, and the extensor digitorum extends the wrist. The OIA is the extensor carpi ulnaris. The origin is the common extensor tendon and middle half of the posterior border of ulna, and the insertion, the medial side of the base of the fifth metacarpal, and the action extends wrist, adducts the hand.
Lastly, for the ab, legs, and glutes, we have the rectus abdominis, which flexes the trunk, the biceps femoris, which extend the thigh and flex the leg, and the gluteus minimus, which abducts the femur. For the OIA, we chose gluteus minimus, and the origin is external surface of the ilium between the anterior and inferior gluteal lines. The insertion is the greater trochanter of the femur, and the action abducts the femur and medially rotates the thigh.